As you all know, kidney is the master chemist of our body. Every normal person has two kidneys, and the fundamental work of the kidneys is to flush out the waste products in the form of urine. So, when some of the crystals which are in excess in the body cannot get excreted, they get deposited in the urine and they form stones. And there are various parts of the urinary system, as I can show you. These are the kidneys, the ureter, the urinary bladder and the urethra. These are the various parts where a stone can get deposited, and sometimes stone can be deposited in multiple parts also. And what are the various types of stones? They are like most common type is calcium oxalate stones. Next is trubite stones, which we call triple phosphate stones. Then other types of stones are like cystine, uric acid and xanthin stones. What causes stones? One of the most common cause is dehydration. Like if we take less water and we do not maintain adequate hydration, it can give rise to sedimentation of these crystals. The other causes could be congenital, could be some obstruction in the urinary passage, sedentary habit, or like a patient who is paralyzed for a long time, not moving. Such cases the urine gets static and it becomes a platform for formation of stones. And some of the diets, like if we take excess of animal proteins, if we do not take a lot of vegetables and fruits, that can predispose to stones. How do the stones manifest? What are the symptoms? Depending on the location of the stones, the symptoms may vary. Like if the patient has a kidney stone, then he will have pain in the back where the kidneys are situated. If they are in the ureter, they will have pain radiating from the back to the front. If the stones are located in the bladder, they will have pain in the urinary bladder that is radiated to the lower abdomen, lower part of the abdomen. Associated with this pain, they can be having symptoms like fever, they can be having symptoms like passing blood in urine and vomiting, nauseating feeling, indigestion. All these are symptoms. And sometimes when a patient has bilateral stones, like both side ureter he has stones, then he or she can land up in kidney failure, and that becomes an emergency. And patients having stones in the bladder can go into urinary retention. They are unable to pass urine, and sometimes they land up in emergency, and we have to put a tube inside their urinary bladder to drain the urine before the definitive treatment. So, this is all about the symptoms. Now, how do we investigate? When you consult your doctor, what we do usually is after complete examination of the patient, some of the investigations are done like routine and microscopic test of the urine to see blood cells, to rule out any infection in the urine. We do ultrasound to look for the location of the stones, and some of the higher investigations like CT scan or IVP. Most of the time these days we are doing CT IVP, that is contrast enhanced CT scan of the kidneys and the entire urinary system to locate the stones, to assess the impact of the stone on the kidneys, to assess the size of the stone, and to evaluate what proper treatment method should be followed for these kind of stones. Now, coming to the treatment, again it depends on the location of the stone, the size of the stone and the impact of the stone on the kidneys. Like if the patient has a stone in the kidney, we have various methods like PCNL, where we make a small hole in the back, get into the stone, get into the urinary system kidney and break the stone with laser. Now, we have still more advanced methods like mini PCNL, where a very small hole, like maybe around 3 to 4 hole is made, and a fine instrument like mini pork or mini nephroscope is inserted to the kidney, and the stone fragment are stones are converted into fragments through laser and removed. Another method for kidney stone is RIRS, which is called retrograde intrarenal surgery, where we do not make any hole. We go from below through the urethra, directly approach the stone and break it with laser. If the stones are there in the ureter, break the stones by laser by putting an instrument through the urethra. If it is in the upper part of the ureter, again we do insert a flexible ureteroscope, which you can reach directly up to the stone and break the stones with laser. If it is in the lower part, we put a rigid ureteroscope, that is called ureteroscopy, rigid ureteroscopy, where again we reach the stone and break the stones. and remove the fragments. If the stone is in the bladder, then we can again remove it through the urethra, and it is called cystolithotripsy, where we put the instrument through the urethra, reach the stone, fragment it through laser or various energy sources and remove the fragments. If it is too large in this bladder, then we can make a small hole in the lower part of the abdomen and put an instrument, approach the stone, break it into fragments and remove it. So, these are the various methods by which we remove the stones. Now, how do we prevent stones? Most important of all is to take care of your hydration. It is very important to drink at least 2 to 3 liters of water daily and avoid excess of animal proteins. Increase your vegetable intake and increase your fiber intake. Limit your sodium intake, do not take excess of sodium, do not take excess of calcium, and avoid high doses of vitamin C. Whatever is required you take it, avoid anything in excess of that. So, these are the dietary methods, and if you have stones, we call once a stone always a stone. So, after you get your stones removed or you get a treatment for stones, keep yourself under regular follow up under your urologist, so that any time there is a recurrence it can be retreated, and what measures are to be taken to prevent recurrence will be told to you by a urologist. Coming to what all facilities are available in our hospital, that is at IGKC Multispecialty Hospital, we have all the advanced facilities including PCNL, we have facilities for mini PCNL, we have facilities for RIRS, that is retrograde intrarenal surgery, we have 2 lasers, one is holmium 120 watt and one is thulium laser, both are considered to be excellent for stones. And for very big stones in the ureter, we sometimes do laparoscopic removal of the stone, and sometimes we can also go for robotic ureterolithotomy, where we use robot help to remove the stone, and fortunately we are the only center in the state which practice robotic urology regularly. So, and all the government sponsored schemes are available for treatment for all the stone diseases. So, if you have stone disease or you have any symptoms of that, or your primary physician says that you have stone and need to consult a urologist, and then we are there for you. You can come to us without any hesitation, avail the best treatment and avail all the schemes that are available by the government, and we will be there to take care of you. Thank you so much.
दर्शक बंधु बिना अपॉइंटमेंट रे सबु रोगर सफल उपचार जानिबा पई हेले एबे ही सब्सक्राइब करंतु हमर YouTube चैनल प्रिकॉशन फॉर हेल्थ आ बेल आइकन क्लिक कला फल रे आपण हेल्थ रिलेटेड वीडियो सहित रहिबे अपडेट।